Good morning, everyone. Thank you for joining us today. Welcome to this dual appointments training presented by our VISN HRD team. My name is Samira Petward. I'll be the facilitator for this class. We would like to go over some housekeeping items at this time. If there's any bargaining unit, well, that's not that many anymore, but if there's anyone that is a bargaining unit employee, this is your opportunity to log off. This training is recorded and your attendance is your consent. This is a foundational training. We would like to highlight that if there's any HR staff that may have experience with dual appointments, will find this training very basic. If you have any information that is different from what I am teaching, I ask that you bring that up to me separately and do not share on the chat. I'm not saying that I don't make mistakes, but if I do make a mistake, I'd rather that somebody brings it up to me and then we'll go ahead and correct it and send the information out to everyone. Okay, so if I can just ask you for that courtesy, that would be great. Now, if anyone is having problems with the chat, technical difficulties, you can open the chat in the browser, okay? So we can go ahead and you can copy the link from the calendar invite on a separate browser, and that should be able to help you. Okay, we're gonna have question and answers at the end. So I ask that you hold your questions and then we can go ahead and answer them at the end. In the case that I don't know the answer or I can't remember at the moment, I will take that question back with me, and then I'll go ahead and provide a response to everyone. Okay? So that's all of my housekeeping items. Let's get started. We're going to just go over what's a dual appointment. We're going to use the utilization of these and some key rules and limitations. Okay? We're going to cover those throughout the presentation. Now, I just want to give you a heads up. This presentation is going to be very much regulation based. I am going to have a scenario at the end, but I just want to go through the regulations so you can be aware of why we do them, where is it referenced, and the limitations and everything that has to do with this regulation. Another point I want to bring up is that this topic is a topic that is throughout the 5005 and the 5007. There's different sections of these handbooks that deal with this topic. So I try to cover, and I'm trying to give you all of the references that talk about it. If I miss something, you can bring it up to my attention on a separate chat, and I'll definitely go ahead and review it. And if it's pertinent to this topic, I'll go ahead and send it out as a message. Okay. All right, so let's get started. I always like to start my classes or include in my classes the regulation. I think it helps us. I know that the majority of the group that's probably here does recruitment, the staffing. So I find it very helpful to know where to go to and actually show it. I know that it's not the best aesthetics for a slide, but I think it connects the regulation with the hands-on. Okay. Before we go forward, I do want to make a note that the handbooks have been updated in the past few years. And at times it might look like it's contradicting, but I encourage you to cross-reference and to read the regulation completely. An example of this is, and I'm getting ahead of myself, but I just want to point it out, that VA Handbook 5007, Part 7, Chapter 5, updated in 2007, includes in one other paragraph that an employee is not entitled to receive basic pay from more than one federal position. If you do a search and you look at that and somebody asks you, can we do multiple appointments or dual appointments, right off the bat, well, it says it doesn't. But if you keep reading further in that paragraph, it does talk about dual appointments and the people that can be appointed. So with that said, just make sure that when you are dealing with topics like this one, that you cross-reference and that you look and that you read thoroughly the regulation. Okay, let's see. So for recruitment purposes, we always know that we go to VA Handbook 5005. That's our Bible for recruitment for staffing purposes. And in part 2, chapter 3, paragraph 3B, I highlighted the whole section and the different areas that we're going to touch on. It talks about, this is the meat of the dual appointments. And I want to also point out that the language changed a few years back. On this last update, I don't know if in 2020 they did an update, but I know that in 2024 they did one. They are referring to the dual appointments as employment in more than one appointment. So if you were to look for all dual appointments, you might not find that specific wording. However, this is what deals with the dual appointments or more than one appointment. Okay. So I am going to read the regulation because I want everyone to get the information and how it reads. Okay. So this section here is going to cover who may hold more than one appointment. And we're going to read what the regulation says in the next few slides. But the appointments are in Title 38 and hybrid Title 38. This section talks about the specific professional groups that can have more than one appointment, the conditions and restrictions, and the recommendation packets. There's other sections of VA Handbook 5005 that you want to review that also talks about dual appointments or more than one appointment, and that is 5005, Part 3, Chapter 5. Okay, so let's go to the first section of this section, which is 5005, Part 2, Chapter 3, Section 3B. Okay, so let's see what this says. So a dual appointment, it means that the employee can hold more than one VA appointment at the same time. This section tells us, and it says it specifically in the bullet A, okay? It says, personnel appointed under 38 USC 7401, parenthesis 1, or 7401, parenthesis 3, may hold more than one appointment. Now, if you've taken other classes and if you're familiar in staffing, that 7401 are your pure Title 38s, and your 7401 parenthesis 3 is your hybrid Title 38s. Now, this section includes a note, and it's a very important note. And it says, any additional appointment may only be on a fee basis, as described in the paragraph B3 through B4. The other group of people that can have more than one appointment are personnel appointed under 38 USC 7405, parenthesis A, and 7406. Okay, so the 7405s, parenthesis A, are your temporary full-time appointments, part-time appointments without compensation. Your 7406 are your residents and internships. The last point that we're going to cover on this paragraph is that it talks about part-time personnel, your 7405s, A, parenthesis 1. And it says, part-time personnel appointed under 38 USC 7405, parenthesis A, parenthesis 1, in any occupation may hold more than one appointment, provided the combined number of regular scheduled hours, including all part-time or intermittent appointments, do not exceed 1,820 hours or the 7/8 per year limit. So it specifically says that the part-times can have more than one appointment. Okay. Now, next section under, or the next paragraph under 5005, Part 2, Chapter 3, Paragraph 3B3. It says, physicians, dentists, optometrists, chiropractors, and podiatrists who hold full-time, part-time, intermittent appointments can be appointed by the facility director on a fee basis appointment for another VA facility or for their own facility to provide coverage when no other staffing options are available, and it is necessary to meet 24/7 staffing level, provided that the criteria in paragraph B6 below in the same section are met, and such appointment would not be contrary to 5007, Part 2, Appendix F, or the department conflict of interest regulation. Okay? So your physicians, dentists, podiatrists, chiropractors, optometrists, they can have those dual appointments. Now, paragraph 4 on this same section tells us that nurses, physician assistants, and other healthcare personnel and non-medical consultants who hold a full-time, part-time, or intermittent appointment may be appointed on a fee basis by the facility director for another VA facility. Okay? And dual appointments must meet both staffing requirements and pay administration rules. So this is very, very important. Just because the flexibility is there, it doesn't mean that we can just go ahead and forget all of the rules about 5005 or 5007. They have to meet them. Now, what is HR responsibility? And this is very important because I've worked doing fee basis for a very, very long time. And you have to know what your responsibility is when it comes to this, okay? So in 5007, Part 2, Appendix F, it says monitoring fee basis payments. Now, we read in the 5005 that a dual appointment can be done for a full-time, part-time, intermittent person. And if they are those type of appointments, they can have a second appointment, but it did have that note that it said it had to be a fee basis. So that's why we're looking at the fee base, the monitoring for fee basis payments, okay? So human resources officials or designee will monitor fee basis salary limitations, provide technical advice, guidance, and assistance to officials regarding salary limitations, and will maintain necessary records and documentation regarding fee payments. HR will regularly review the payments associated with fee basis, part-time, or intermittent appointments to ensure an employee combined earnings do not exceed aggregate pay limits. HR officials will regularly review aggregate pay projection reports in HR Smart prior to authorizing fee basis appointments to ensure fee basis payments will not cause the employee to exceed the aggregate pay limit. HR will code the approved annual pay limitations for each fee basis employee into HR Smart, and the HR Smart system will generate a biweekly message to the facility when a fee basis employee is within 10% of reaching the annual pay limitation in the employee's master record. HR officials will be responsible for notifying key management officials, service chiefs, chief of staff, medical director, when a fee basis employee is nearing the aggregate pay limit. In no case may the total fee of fee payments exceed the rate for the corresponding listed in paragraph 4 of this appendix, or cause the employee's earnings when combined with other appointments to exceed aggregate limit. Additional information for aggregate pay limitations can be found in 5007, Part 7, Chapter 2. So that was a lot, but HR is responsible for ensuring that the pay limits are not exceeded, to provide the correct guidance, to monitor the fee basis salaries, to document. So it is imperative that we as HR specialists, when we're working with fee basis, we are ensuring that is done correctly from beginning to end, okay? Now, the recommendations for dual appointments. That part is covered in 5005, Part 2, Chapter 3. This is paragraphs 3B8, okay? And it says, and this is very, very, very important, and I will tell you why after. Recommendations to approving officials should include sufficient information to indicate that employment in more than one appointment is justified. Officials will ensure that appointments in more than one appointment will not present or lead to a conflict of interest or the appearance thereof. Questions concerning conflict of interest matters may be directed to OGC Ethics officials. It's very important that you make the director aware of what he is signing, okay? It has to be justified. It has to make sure that it includes the reasons why this is so needed and why we're not going to recruit a regular full-time, part-time, or intermittent, which is what is supposed to happen when there's a vacancy. Okay, all right. We're going to cover now the conditions and restrictions. Now, dual appointments are used to fill critical gaps in staffing, especially when patient care coverage is needed around the clock and no other qualified candidate is available locally. What does the guidance say? 5005, Part 2, Chapter 3, Paragraph 3B. It says, under Paragraph 3B6, it says, the facility director may approve more than one appointment subject to the following conditions. Services are essential to the healthcare needs of patients. No other equally qualified individual in the specific specialty is available in the locality. There's no violation of compensation statutes or VA policies. There's more information as to why the facility director can approve multiple appointments, but I'm going to read just a little bit because it's extremely long, the paragraph. So I'm going to refer you to go and read 3. Let's see, this is section 5005, Part 2, Chapter 3, Paragraph 3B, Paragraph 7, okay? I'm just going to read the leading sentence and let you read the bullets because it's a little bit longer. You can do that. Make a note and do that on your time. The facility director may approve the following multiple appointments only in exceptional circumstances. That is key, okay? Exceptional circumstances. It can be that the chief of the department wants to fill in the position just because they think that this is an easier way to bring somebody on board. Exceptional circumstances, okay? Now, let's go over pay limitations, okay? Pay limitations apply to dual appointments, and this is extremely important. If anything, it's all very important, but this here, you can cost somebody a lot of money and yourself a lot of work to try to correct an action, okay? That it has to do with the pay limitations. So pay limitations apply to dual appointments. Total compensation, including fee basis earnings, cannot exceed the president's annual salary which is currently $400,000. I am using here an example of a physician or a dentist or a podiatrist and optometrists that are now on the same pay scale. So they are also included. But they cannot, the salaries for physicians are the highest in the system, right? In the pay system. And there's some specialties that can make up to that $400,000. So it's imperative that what the pay limitations are before you just push through a fee basis appointment. Okay, and we'll go into an example. Okay, but the performance pay for the physicians is also part of their pay. So on top of their salary, they also get performance pay, and that can be up to $15,000 or 7.5% of their base and market pay. So you have to take that into consideration. Okay. Now, the regulation in 5007, Part 9, Section 14. It says, in no instance may the aggregate pay, that is base pay, market pay, performance pay, recruitment, relocation, retention, incentives, and any other pay under Title 38 authority received by a VA physician, dentist, podiatrist, and now optometrist in the calendar year exceed the annual pay rate, excluding expenses. Okay, so that's how the regulation reads. Okay. Now, it has an additional note. For part-time employees, the actual earnings, which their annual pay is prorated, will be considered when determining whether this aggregate pay limitation will be exceeded. Okay, so I just bring that up so you can at least have it on your radar that all these salaries, all these pay that the person can receive all count towards that pay limitation. Okay. Monitoring and compliance. So HR plays a key role in monitoring and compliance. You must track the combined hours and pay, coordinate with other facilities, and document all approvals, okay? I'll talk about it a little bit more about the approvals on the next few slides, but it's part of the HR function, okay? Now, some common pitfalls of the dual appointments is that they can exceed the pay limits, overlapping schedules, missing documentation. And this can lead to compliance issues, so please stay vigilant. One of the things that, in my experience, that I saw is that when reviews are coming for HR to be reviewed, like any cards review, the first thing that they required to see were all the fee bases, were any dual appointments. And they were looking for correct documentation. They were looking for the pay to ensure that it was correctly done for pay limitations. So these dual appointments have to be treated exactly how you would treat a regular hire. Okay. The dual appointment, even if the person works in the facility, is not, oh, I'm going to convert him. No, it has its own process and it has to be kept as its own process, because if there's a review of any kind and we're out of compliance, that's not going to be good. If somebody's being paid more than what they should, and sometimes these errors might take place or be discovered at a later time, corrections are done and they're done through the system. And unfortunately, you have to make that phone call and tell somebody, oh, sorry, you did make more than you were supposed to. All right. So some key takeaways for dual appointments is that they fill critical gaps, but they come with strict rules on hours and pay. So I encourage you to always document, to monitor, consult resources with your supervisors, with your colleagues. If you're not sure how to do a fee basis, please ask. Don't just put it through and think that it'll resolve itself, that nobody's going to find out or what. Ensure that it's put through correctly. It can cost somebody money or aggravation. I'll give an example. I did have come across a physician that had a dual appointment. I wasn't aware of it. I had come in the middle of it. And by the time that he figured out that he was going to reach that 400,000, they had stopped his market pay, which is the one of the components of the pay. And he was not getting paid that, I want to say, by November of that year. So he only got paid partially for from his salary, even though, yeah, he made $400,000. But what we need to care about is that is done correctly, okay? And that we can make sure that we prevent any errors in pay or coding somebody, because it's very hard to correct those things. And it did take me several months to correct that. So just make sure that documentation, critical gaps are important, but you want to make critical gaps, it's important to fill them, but we want to make sure that we do it correctly. So I thought I bring somewhat of a scenario. This is a complicated topic if you've never done them before. So I am going to start from the premise that everything that's required for a recruitment is in place, okay? So I'm just highlighting the overall. So if you think that I'm not covering something, it's just that I'm doing the overall of a dual appointment. Okay. So we've reviewed most of the regulations that are applicable to dual appointments or more than one appointment. One thing to remember is that when we deal with dual appointments, the most common dual appointment involves that fee basis that I mentioned. Especially since the regulation changed a few years back, where now it's allowed to do dual appointments at the same facility that a provider is working at. You want to make sure that those records are correct, okay? So you're going to hear that I'm going to talk about fee basis, but it's because that's the most common one, okay? There's others. There might be somebody that has two part-times or a part-time and an intermittent. And with those, there's fee limitations also. So you have to get familiar with what are the fee limitations for that profession and ensure that they stay within those limits. And one important point is that two part-time appointments do not equate a full-time, okay? So make sure that you're aware of that. Now, how do we put all this into practice? And I'm going to use the example of a physician because it's one of the most common ones. So let's just say that there's a physician or a Title 38, dentist, podiatrist, that has with a fee basis. So that's going to be the scenario, okay? A full-time provider with the fee basis. Let's assume that all requirements for recruitment are in place. And for specific of your processes in your sections, I refer you to your leads, to your supervisors for that. Like I said, I'm going to be doing an overall. So let's say that there's a service chief wants to bring on a fee basis. You want to, as a dual appointment, okay? Not just a regular fee basis appointment, but we're talking about dual appointment. So you want to discuss with that provider, and the approach that the chief is coming across is, I want to get this person right away. He can start Monday. It's a fee basis. He works here already. We can make it work. So you have to have the discussion with them because it's not. They are treated as a separate appointment, and you have to have everything that you need to ensure that that recruitment file is complete. Other things that you might want to bring up is, and I did come across this many times, is that they would just go ahead and think of that dual appointment, that fee basis, as a perpetual kind of appointment. And when we look at the regulation, the fee basis as a dual appointment is done, what did the regulation said? In extreme circumstances, when there's no other way of filling that gap, there's that critical. So it's not something that I always refer to it as like a band-aid, something to just go ahead and fix it for now, make sure that we do it correctly, but it's not a perpetual solution for that need. So that's part of the conversation in that consultation with the service chief. You want to make sure that they understand if it's a dual appointment for somebody that is another facility, that you would go through the process of ensuring that they meet the basic requirements, they have to go through the credentialing, they have to do that onboarding. I know it might be tedious. I know the person might probably feel annoyed, but it is the responsibility of HR that recruitment is done appropriately and correctly, and that we have everything that we need. Okay, so those are things that you need to discuss with that service chief, just to say you got to be patient. We're not able to do it overnight. It's not that much quicker, if you want to use that term, than a regular hire. Okay, it might be a little bit shorter, but they still got to go through all the same steps as a hire. Okay. Now, there has to be a vacancy. There has to be approval to recruit. Like I said, you have to take a look and discuss those fee limitations. Because it is a fee basis, they can be terminated at any time. So those are the things that you want to discuss with a service chief or a manager that wants to hire a dual appointment as a fee basis. All right. Now, I thought we do somewhat of a practical exercise. It's not a major one, but let's take a look at this. So let's say that we have a Dr. Smith. He works full-time at facility A and holds a fee basis appointment at facility B for specialty coverage. This is allowed because the service is essential. There's no other qualified candidate, and pay limits will be monitored. Okay. So this is the scenario, the perfect scenario, okay, where somebody is that it can be done. Now, let's take a look at somewhat of a practical scenario. So let's just say that you receive that MSS request, and I will refer you to JAB 805 RP 031 because it has a process for this, okay? But let's just say that that MSS request has all of the required documents and those documents are in that job 8. But off the top of my head, it has the CV, it has the justification, the memo for the appointment of as a fee basis, as a dual appointment. It has to include that in there. Remember, we got to provide the director with as much information as possible to see if he provides the approval for that. Okay. HR is going to review this packet. You're going to make sure that that is correct and that it meets all the requirements. So when you look at that, let's just say in this scenario, let's just say that Dr. Smith works at facility A and his salary there is 375,000. For the fee basis appointment that they're trying to hire at this facility B, the total fee limitation recommendation that's approved is 30,000. So it's doing a bit of a simple math and remembering what the maximum is for a physician, which we said is the president's salary, which is 400,000. So how much is the fee limit for that fee basis appointment? Can anyone just throw out the number on the chat? So I see that, okay, I see that there's a few people that are saying 25,000. Okay. 25,000 is, yeah, because that's that 400,000. However, for physicians and dentists and podiatrists, optometrists, they have an additional part of their salary. I mentioned that they get performance pay, and that performance pay is up to 15,000 or 7.5% of their salary. So if we take that into consideration, how much is left after we add that 15,000? I see 10,000, I see 40K. Okay, perfect. Perfect. Yes, you're tracking. 10,000. Perfect. So the fee basis, we must take into account that there's awards, there's 3 Rs, that there is that performance pay. All these are components of the aggregate limit that provider can make. So when we review a packet that comes through and says that they want to pay this fee basis physician as a dual appointment, $30,000, what should we do? What does the HR specialist has to do? Do we just push it through, send it to the director? Do we have a conversation? What are the things that we do? Somebody said decline. That's kind of like that's another word, but yes, we need to have that conversation with that chief. We need to go bring these numbers. Hold on, I think I had it on. Okay, I think I had it on a separate. We have to have that conversation. We can't just push paper through and say, oh, somebody else will catch it. It's our responsibility. We read it in one of the slides to monitor, to not exceed the fee limits, and to make sure that what comes through is accurate and that it makes sense. Okay. So if their total salary, assuming that they're going to make up to 15,000, doesn't mean that they will, but we have to assume that, right? We don't want to set the provider up for failure and give them a tentative offer, letting them know, oh, you're going to make another 30,000 or $40,000. And then at the end of the year, there's that fee limitation notice that tells us, oh, listen, he's nearing that limit. He can be paid. And let me tell you, they will stop their market pay. They don't send a note. They don't, unless it's something recent, but as of 2 years ago, they didn't send a note. And that provider just got a check only with partial pay. So it is our responsibility as HR specialists to review the requests that come through, not just to push them through thinking it's not my problem. Oh, they really want it. Oh, they really have a need. No, we are the gatekeepers, and it is our responsibility to review that. Okay. So I just wanted to emphasize that because you don't want you it was a very hard conversation from experience to have to call somebody and say, listen, I'm really sorry, but they are your pay is going to be withheld, your market pay, because you've exceeded certain limit. Now, I until in my experience, I don't know if it's happened, but the fee basis, they get an LES, and from the physicians that I talked to that had dual appointments that exceeded, it didn't marry the two salaries up. Okay. So I always, when I was gonna hire a dual appointment, I had that conversation up front. I pulled up their salary. I make sure that I did the numbers, that I make sure that I did the numbers, including that fee basis that they were gonna be offer a tentative offer for, to make sure that they were aware, listen, you're not able to make that more than 400,000. During COVID, there was a waiver, but that waiver expired. I don't know if there's any other ones. I did look for any waivers. I didn't see anything. Maybe our CCOE partners may know a little bit more since they deal with pay. And if there's one out there and they are aware, then they can provide that to me, and I can share it with everyone else. But as far as I know, those two systems did not talk to each other. And when we found out, it was very, very late. And it took months to have it rectified. And in my experience, this one physician, he was very close to that 400,000 limit. And I did have the conversation with him, even though I was monitoring on my end. But I did have the conversation with him to say, listen, you have to monitor it too. You have to know that if if your year to date is already 395 or 390, and you're making in 5 days that you work as a fee basis, you're making 15,000, you have to know that you can't sign up for those days, because you are going to go over the limit, and it's going to put us back into this situation of having to rectify something that is very difficult to rectify. So I say all that to say, keep it on your radar. Make sure that you have the conversation, that you talk to the service chief, that you talk to the provider when you are making the tentative offer, when you're going over the numbers, and that is clear to both sides. Okay. This is something that as part of the clear communication, I did have the conversation with both. I did put it in writing, and I made sure this is something that I did. I'm not sure if this is a process out there right now, but this is what I did, and it worked for me, and it kept it clear. I included what the regulation said in 5007 Part 2 Appendix F. And I included the entire on the tentative offer. I put a note, and I put, if you have an additional VA appointment at another facility, this applies to you. And I said that because not everyone was honest to tell me whether they had it or not. Okay. So in order to cover that, I worded it that way. And then I put what the regulation said, and I ensured that I put the number, the salary, the 400,000, so they knew. Okay. This is something that I did it on the tentative offer, and I also did it on the firm offer. Okay. So that, as a final note, you want to make sure that you review the guidance and documentation. If you're unsure, please seek assistance. Don't push things through if you're not aware of it, or if you think somebody else is going to catch it. Make sure that you get with somebody that knows it, and then you can just go ahead and work through it. And trust me, once you start doing this more and more, then you'll get the hang of it. One thing I do suggest is, don't rely on your memory. Always go and look at the regulation. Look for HERMOS, for those HR letters. Look for those bulletins. Look for things that might be out there that may affect this, okay? Ensure that you do your research. One of my common practices was that I would go ahead and create for myself a document, and I had it for dual appointments. I went ahead and I found all regulations that I could find that had dealt with dual appointments, and I put the regulation, I put the which handbook, what section, down to the paragraph. I would make sure, and I kept that document with all, including the dates, okay? Because sometimes the if you keep an old document and it gets updated, I kept everything in one document that related to the dual appointments when I was going to go ahead and do that one action, just to make sure that I stay in compliance and that I didn't rely on my memory and then will be like, oh, wait a minute, I made a mistake. This changed. So that worked for me. And like I said before, this type of appointments, dual appointments, fee basis, were one of the things that review committees like the cards or the O&E looked at first. And if we had errors, we had to correct them. So that is my final note on that. I have, in summary, we covered that 2 or more appointments at the VA at the same time can be done. That if it's a full-time, part-time, or intermittent, it's a hybrid or Title 38. Appointments can have additional appointments, but they have to be a fee basis. We covered that no other staffing options are available. That is only the recommendations to the approving official should include sufficient information to indicate that the employment in more than one appointment is justified. And we also covered that HR has to provide the technical advice, it provides guidance, it monitors fee-based salaries, limitations, and it maintains documentation. So that is, let me see, I think I want to do the post test and then we'll go into questions, okay? So let me just launch the test, and if you can all, I need at least 45 people to respond, okay? Just so we can compare it to our pre-test. So please, I'm going to give you a couple of seconds to go ahead. Perfect. I got 49. Okay, so let's do it. So the first question is, a full-time appointment and a fee-basis appointment, dual appointment is not permitted for a physician at the same facility. True or false? We read it in one of the first slides that it is false. They can be appointed at the same facility, but remember, it is if there's no other options in extreme circumstances, and you have to provide the facility director with as much information as possible in order to support and justify it, okay? Second question is, there is no salary limit for a dual appointment since it's an emergency patient care need. And that is actually one of that was one of the main reasons why I would always have to have that conversation. Patient care needs. So yeah, yes or no? No, that is false. There's pay limits and we have to monitor them. That's HR's responsibility. The last question is, an HR specialist can have a dual appointment, and that is false. It's only hybrids and Title 38. Thank you so much. We got 52 responses. That's great. Thank you. Thank you. There's some people that still were not too sure about it. So once we post this, I recommend that you guys review it and make sure that you are familiar with the regulation. Remember, you don't have to know it by memory. All you need to do is know where to go and find the applicable regulation. Okay, I think there were some questions. Somebody said, I let them know of the limitations, but push it through. Sometimes they know the employee is resigning or retiring, but will continue as a fee basis. Actually, that brings up a really good point. I will come across this scenario often where a physician that was a full-time would go ahead and they accepted a position somewhere else, but in that it's not really a dual appointment, but it's it's kind of like on the borderline that they had a position that was a full-time, they want to resign and go ahead and be a fee basis, and they thought that they can convert them because they're already credentialed, they're already this, they're already that, they've been there. And unfortunately, there had to be a break in service. We had to make sure that we did a hire for the fee basis, and we made sure that all of the information was outlined correctly. In order, what if they decide not to resign, or they change their mind and now we're in a fee limitation issue. So it's good to have clear and communication with the managers, because things can change and people can change their mind. So let's see what else. Who monitors how much the fee basis makes so they don't go over the HR specialist has to monitor it. We covered that in one of the slides. Let me see, what slide was that? HR responsibilities, and that is in BA Handbook 5007, Part 2, Appendix F. Okay? Okay. Are there any questions? We can open the mics. We have 3 minutes before we have to go. But if anyone has a question, this is the time to do it. And I will go ahead and launch the survey. And I am going to, don't close the chat, because I'm going to give everyone all of the references that I use for this. There were a lot of them. And these are the handbooks, but I included the fee basis presentation that we have on demand, because this is very closely related. There's a fee basis user guide, HR, there's job aids. There's the cards group has a checklist that can be used. So these are all very valuable resources, and I'll just want to make sure that everyone has access to them. I kind of did the homework for you and went ahead and put it all together. So make sure that it's available to you. Let me just post here the reference sheet that has all of the references is in that document. There's a question. If a doctor full-time appointment retires and comes back on a fee basis, how does the aggregate pay get adjusted, process documented? Well, if he retires, that's it. He's coming back only as a fee basis. So it doesn't affect it. And they can come back and be a fee basis. Unless something changed that I'm not aware of, but from everything that I've looked at, it can be done. That is not considered a dual. So last thing I'm going to ask, if you can just do the survey, please. This helps me to see the things that I can improve on or include on my training, or if you have another training that you would like to see. I am working on doing a pharmacy resident dual appointment. That's going to be in the next coming, hopefully, weeks. So be on the lookout. I know that's another hot topic, but I will be working on that as well. I just want to close by introducing or mentioning my team. They're a valuable part of our trainings, and we are led by Marcus James. My team is composed of Lisette Lima, Valerie McKinney, Samantha Tabo, Angel Torres Morales, and Luis Torres. And I want to thank them for all their support always. If you ever have any questions, please reach out to us via our email, visn8hrd@va.gov. And please don't forget to review our HR newsletter. It includes all of our most recent trainings, and it's a very good source of information. I'll leave this on the screen. Thank you. Just some positive notes. I hope that your day is great, and I will go ahead and put the survey. If you click on the screen on the survey, you can go ahead and do the survey. So don't close your screen so you can do it. All right. Thank you so very much. We'll see you the next time. Thank you for participating, and we'll see you at our next training. Thank you so very much. Thank you, everyone.